Hi there, I'm Lucy McDonald, physiotherapist, and I have been asked to do a video blog on patella tendinopathy following my video blog on tendinopathies or tendon pain in general. So, uh, important things to note about tendinopathy of the patella tendon. So what on earth am I talking about if anyone's watching this and wondering what a patella tendon is? So your patella is your kneecap, and the tendon that I'm talking about goes from the bottom of your kneecap and inserts into the bony bit at the front of and top of your tibia, called your tibial tubercle. And it's a super common tendon to have pain in. As I mentioned in my last video, it's a tendinopathy, not a tendinitis, because we now know that it's not inflammatory. Itis just means inflammation of. So by the time your patella tendon is painful, we know that actually there's been structural changes inside the tendon itself, both the collagen fibres, the nerves, blood vessels, all affected. First thing before launching into specific stuff for patella tendons, one of the things I think is really important with this particular tendon is to make sure that other structures aren't involved. And in fact, let me reword that, almost always other structures are involved. So normally there's some irritation of the fat pads that sit underneath the tendon or around the tendon, and also the patellofemoral joint itself. So you can often get pain kind of shifting around. The good thing is that most of the problems that are involved with a patella tendinopathy are treatable with the same rehab approach and hands-on approach, but with the exception of the fat pad. So the fat pad is particularly irritated by fully extending, so fully straightening the knee. And so if this is the case with you, you might need a period of time where you're avoiding that full extension, full straightening, and then building up to strengthening within that what we call outer range, so from a very slight knee bend to a fully straightened position. So that's if there's fat pad involvement. So super important, obviously, to get all injuries checked out so that you can have your treatment specifically targeted at the structures that are involved. So presuming you've got that classic tender spot that you can poke right over the tendon, and that you haven't had any trauma, then the most common reason that I see for patella tendons not getting better is incorrect loading. So quite often people are not loading the tendon enough. So as you'll know from my last video, tendons love being loaded, but they only enjoy or respond well to graduated, small, incremental increases in load. A sudden increase in load is going to cause a tendon to flare up. So treatment's all about gradually increasing the load through the tendon in small amounts. And quite often, because it can be an uncomfortable process, people hold back on loading the tendon. So it's okay. What I tend to say is that it's okay to have pain at around about a 3 or maybe even a 4 out of 10, 10 being the worst pain you can imagine, 0 being nothing. So around those kind of low levels of discomfort rather than intense pain. It's okay to feel that during the exercises and for up to say 3 to 4 hours after, but then the pain should fully resolve, and you certainly shouldn't be noticing an increase in pain over a sort of 24, 48 hour process. If that's the case, then you're doing too much and you just need to tone it down a bit, or your physio should tone it down a bit for you. But it's fine to feel some discomfort during the exercises. And in fact, from my experience, actually feeling that discomfort is an important part, because if you're not feeling that discomfort, you often don't get the same results. So loading the tendon enough is really important. And also through the range of motion that you need for that tendon. So if your pain is mostly when you're walking on the flat, then you're only going to need to work the tendon through a relatively small range of motion. Normally though, tendons are also painful going up and down stairs, and in which case you need exercises that load that tendon through the range of the larger ranges of motion that you need going up and down stairs, likewise sitting, getting out of a chair. Now, The third thing is to make sure that you're loading the tendon. So the first one is making sure you're loading it enough. Second one is making sure you're loading it through the range. Third one is making sure that you're loading it with the speed and the requirements necessary for your activities. So it might be, for example, that you're a trail runner, for example. If you're a trail runner, you're going to need to train that larger range of knee bend and straightening at a much higher speed than someone who only requires that range of movement for going nice and steadily up and down stairs, as an example. Likewise, if you're doing sports that involve changing direction, you're going to need to do a lot more change of direction work for the tendon. So those are the most common things. Oh, and another big area. So first of all, you've got that loading component. And then the second equally important component is getting your biomechanics and your alignment sorted. So often the tendon might be taking the load incorrectly, more one side than the other. And that's down to the technique that you're doing your squats or going up and down stairs or running or walking. Or wearing heels, that's another one that can aggravate it. So all of those things need to be looked at, and there might be that your physio needs to look at things like your foot position, strengthen the muscles in your foot, give you appropriate footwear, or maybe even some basic insoles. Likewise, if the feet are affected, then almost definitely you're also going to need some exercises to work the stability muscles of your hips and your pelvis. So make sure you check out the alternative or other structures that could be involved with the tendon, number one. Number two, make sure you get your loading program right. Number three, make sure you're looking at your biomechanics. Number four, hands-on can be really helpful, especially while you're loading the tendon. The muscles might get a bit sore, so hands-on can be really nice for just loosening everything up and enabling you to push on forwards with your exercises. And finally, last but not least, making sure that you're doing everything you can to help recovery of the tendon and the muscles involved. So things like nutrition, sleep, rest. We know that tendons are particularly affected by things like hormones and other systemic factors, so other factors in the blood system. So you doing everything you can to help those things, looking after your mental health, looking after your nutrition, all those things can make a huge difference to tendon recovery. I hope that's helpful. If you have any other questions about patella tendons or any other, if you'd like me to do any other video blogs about tendons or any other topics, please let me know. My contact details are lucymacdonaldphysio@hotmail.co.uk, or you can contact me through our website www.octopusclinic.com. I look forward to hearing from you. Please do subscribe on YouTube, Facebook, Twitter, and thank you for listening.